Joining me now is Sean McMurray. He is the Chief Executive Officer of the Northeast Market for Mountain States Health Insurance, as well as Vice President and Chief Executive Officer for Johnston Memorial Hospital in Abington, Virginia. Sean is a longtime healthcare executive who serves on the Virginia Hospital and Healthcare Association's BFD. He's also very active in his area. It is a pleasure to have you on with us, Sean.
Thank you very much, John. Pleased to be here.
Okay, and Sean knows that when he's on the John Fredericks Show across Virginia, we're trucking the truth. Now, Sean, since we've been broadcasting live here today from the Virginia Hospital and Healthcare Association's annual meeting in Hot Springs, we've been talking about healthcare in rural Virginia, which is a big topic of mine. These are challenging times for the healthcare industry in these areas of Virginia. Now, Sean, managing a hospital and a co-op group as you do in this area, what personal experiences can you share with our audience about some of the real hardships rural hospitals are facing in Virginia right now?
Well, as you know, John, rural providers face a significant number of challenges. Some of them are demographic. We have an aging population. Some of them are economic. Generally speaking, we serve smaller populations in less economically affluent areas. We have more people who tend to rely on subsidized health care programs like Medicare and Medicaid. And what this means is that we can treat people that have more health challenges, especially as they age, and they also create a situation where we have to absorb more of the cost for treating those folks, and it puts rural providers in a bind. So as you know, nearly half of the acute care hospitals in the rural areas in Virginia lost money in 2013. We had negative operating margins. So not due to any mismanagement, but it's a result of the heavy government regulation of health care. And it requires hospitals to give away a significant amount of free and discounted health care, and it makes it very challenging for us to operate in that environment, and does pose a threat to our future survival in rural areas.
Well, you've got indigent care, obviously. Sean's a big issue. But, the other thing you got going on right now is that, look, hospitals, these are not public hospitals, right, run by the government. These are private hospitals. They're profit-making entities. They have investors, stakeholders. And, you only lose money for so long in any business before you either downsize or change it or take it out, right?
Yes, I would comment that a number of ours are not-for-profit hospitals, but we have to generate positive margins to be able to replace equipment and give salary increases to our staff. So it is important for all of us to have a healthy operating margin to be able to survive in the future.
Now, how have rural hospitals right now, how are you coping with the, let's call it, non-profitable environment or negative margin environment that you're in? Because, look, even a nonprofit can't continue to lose money, all right? It just doesn't work. The math doesn't work because, people stop donating in and it just stops. So how are you coping with this now?
Good question. And we've already seen, for example, in our area in Southwest Virginia, we've seen one hospital close recently for the very reasons that you mentioned. Frankly, hospitals are tightening their belts. We're looking for savings. We're trying to operate more efficiently, but there's only so much you can do. We have to look at things like staffing or what services that we offer, and there are only a certain number of things that you can eliminate or that you can decrease to be able to save money. So the longer that the challenges persist without some relief, we're going to have to make some tough choices as hospitals about what we do and how we go forward. And that's also economically challenging for the communities that we're in, because many of us are among the largest employers in our rural areas. And so it's both an economic driver as well as a healthcare provider. And when we jeopardize that, it creates some real challenges for the communities we serve.
Now, Sean, I've been telling my listeners about the situation for months, about the need to do something and get off the dime and stop having the same dumb argument over and over again that just isn't going to end in a positive way. Now, I know that hospitals are working with stakeholders across the political spectrum, searching for a compromise to these challenges. I also know that it's easier said than done. It's easier for me to get on the radio every day and say, hey, we need to solve this. It's a little bit tougher to actually have it done, especially in the very hot political environment that Virginia is in right now. Now, one way that hospitals have done this is through a public awareness campaign, trying to get average citizens involved, engaged, and up to date on what's happening. Can you share with our audience how that's worked out?
Yes, we're very excited about this public awareness campaign. We're calling it Virginia Hospitals, Our Lifeline. And it was launched this year to start the dialogue with both the public as well as policymakers about the tens of thousands of jobs that hospitals provide and the billions of dollars of economic contributions that we make in the state of Virginia and across this country. Hospitals are very, very valuable to the economy and to public health. And we hope that by sharing that message, we raise awareness about the need for compromise solutions, creative solutions to help Virginia continue to enjoy a strong healthcare network and all of the benefits that are associated with that. And so I encourage your listeners to visit our website, and it's isupportvirginiahospitals.com.
Okay, that's isupportvirginiahospitals.com.